Hi everyone, Rosa here. Today I wanted to talk to you guys about how hard it is to get health care here in the Bay Area, whether it's from the start where you apply for it all the way to actually being seen by a doctor. Trying to get preventative care you're very lucky if you get an appointment. As a matter of fact, did you guys know that the number of uninsured adults in the Santa Clara County went up 10% in the past 15 years? It went from 8% to 18%. And 37% of those people are Hispanic and only 8 being white. That says a lot. I know they're just numbers, and once I do my essay, I'll have a chart, but right now that says a lot, and that has to do with the inequality of distribution of the budget here in Santa Clara County. If you've driven, walked, flown, whatever type of transportation anywhere around here in the Bay Area, you can see that there is a very difference by neighborhoods of the funds they get, whether you're driving in Santa Clara, Cupertino, San Jose, even the east side of San Jose to the west side of San Jose is completely different. So that has to do a lot. And with people of color being sometimes in not the best neighborhoods or parts of the city, that has to do a lot with it. Another thing is, a lot of people don't know where to access healthcare, how to apply for it. And that is also a big factor in people not having, insurance. Sometimes when you want to make an appointment with a social worker, they're backed up for months. And it isn't beneficial for anybody. It's not beneficial for the county. It's not beneficial for the patient, the person, the resident that's trying to just be seen for a medical issue that's not so extreme yet. But we can't do it. Another thing that adds to it is once you do get your insurance and you're approved and all that, try making an appointment with a doctor or any type of specialist or anything. It's practically impossible. You'll be seen months out, and sometimes, and even when you go on the portal and try to make an appointment, it's going to be like, well, how bad do you want to be seen? It asks you if you have COVID, if you've had a fever. And actually, speaking of COVID, things have gotten worse since the end of the pandemic. We now have insufficient staff. There's not enough nurses, not enough doctors. And the staff that is there is overworked. They do more than they're hired for, than they're paid for. And that leads to things like, sometimes malpractice. And that's why nurses go on strike. Just a matter of fact, this year, around March, April, nurses organized a strike in Stanford Hospital, and Santa Clara Valley Med and O'Connor Hospital. And that sucks because it's, like I said, it's just a continuing cycle of everyone being affected here. From the staff to the patients to just everything. And it makes it worse. It's like a ticking time bomb. So a personal connection I have to this is I was myself for the past couple of years have struggled to get medical appointments. I had a health concern that just got worse and worse and worse, turned into sepsis and a whole debacle there. And once I did get seen, it was basically a matter of life or death, when this could have all been avoided if I had the preventative care I needed, and if I would have gone, a diagnosis on time, the help I needed. But no, it made it. And once I was in the hospital, they made it seem like it was my fault. Like, oh, why'd you let this get so big, or blah, blah, blah. And I'm just there flabbergasted that you're blaming this on me, and that also leads to long wait times in the actual ER, not just let alone preventative care, in the ER. And, sometimes you might ask yourself, so why should I care? Well, you should care because this could affect not only you, but your loved ones. A lot of people complain about their tax money not being used properly, and this leads to it. Just as a matter of fact, Santa Clara County just bought a hospital on the east side of San Jose, Regional Medical Center, and they're going to make it into another county hospital. According to them, this is supposed to help, make wait times a little bit better and more people to get care. People specifically on the east side that don't have to drive across town to get help. But we'll see how that turns out, because I practically don't think this is helping. We need more people in the places we already have, not more buildings, but we'll see how that works. And, the lack of preventative care, like I mentioned before, leads to more ER visits, and that's costing the healthcare system way more money. As a call to action, I think we should all support and be kind to the staff that is there, specifically nurses. And if they do go on strike, support them 100% because they have every right to do so. As much as we like doctors and all this, doctors, yes, they do their work, but nurses are the key to making it out alive from a hospital. Another thing is we need to learn how to advocate for ourselves, how to make sure we fight for the care that we need, for the resources that we need, and not make it seem like we're a burden to just not the county in general, but just to the system. And the lack of inaccessibility of healthcare is not just a policy issue. It could be a matter of life or death for many residents here in the Santa Clara County. We need to do better. As a matter of fact, aren't we called the Silicon Valley, where everything is nice and, high tech and bright and just all rainbows and sunshine? So we need to do something about it.